I'm Pamela Sims Mackey. I am the Chair of Pediatrics and the Chief of Graduate Medical Education at Alameda Health System. So first of all, Alameda Health System is the safety net healthcare system for Alameda County. We have 3 acute care hospitals, soon to be 4, 1 psychiatric hospital. We have 4 wellness centers. We have 5 post-acute care centers and mobile van and a bunch of other stuff to take care of anyone. And we have 4 pediatric clinics within Alameda Health System at our clinics at Highland, Eastmont, Newark, and Hayward. We have an inpatient nursery as well as a level 2 NICU as well. The state has these quality metrics in healthcare, and it's really to help promote best practices. When I arrived at Alameda Health System a little over 4 years ago, they were not meeting these metrics, and it was not because they were not doing the work or delivering good care. I think when you work in a safety net, you are really mission focused.
We had a really clear charge for our group, which is how do we improve care? How do we improve accessibility for our patients and our families so that they can get access to these really important child visits, developmental screenings, immunizations that are so critical to their ongoing and future development and health?
We had an interdisciplinary team that came together. We looked at the whole situation. We could take a step back, and we ended up creating this big, what they call fishbone diagram of all the different things that were preventing us from meeting these metrics in our system. After 3 years, we have had phenomenal results. We are not only just meeting our metrics, but at the 90th percentile for the majority of our metrics.
Mainly, it's trying to get a hold of our patients and our families and letting them know that they have things they need to get done.
One of the things that we did was with our text outreach campaign. So we have a report that we can pull that every patient that Anita texts outreach, we want to see, is it working? Did these particular patients that she texts schedule an appointment within 2 weeks of that text? And then I provide the data, and the data is remarkable. And we have shown that they really work.
We try to pull apart our data to see where are any disparities that may exist. And we did see that there was a disparity with our African American patients in well child checks and immunizations. One of those issues was transportation. And then we started to educate our families about what transportation their insurance companies would provide for them to make it to care. We started to put that on our, we call after visit summaries on every patient so that they have a way to arrange transportation for their return visits.
Care gaps are alerts in our electronic medical system that anyone opening a patient's chart can see. The registration clerk sees that a patient is due for a certain type of appointment. They can help that patient schedule that. Or nurses, for example, now if they see that a vaccine is due, they can order that themselves without having to double check with somebody. And providers also can use that to, close gaps in care. Pediatrics was the first department at AHS to implement self-scheduling for patients. And so I think this also really helps with the patient-centered care that we're giving, empowering our patients to be able to make appointments for themselves and schedule them and kind of take charge of their health care.
One easy way to describe Dr. Sims Mackey to me as a leader is somebody who really walks the walk. A culture of improvement work, celebrating success, but also still pushing us to work harder, and that she holds herself accountable to, I think is a really remarkable and unique trait in a leader.
She went from taking care of me to my kids now, and they love her. I got the best care here from Dr. Sims and everybody else here. They're all so nice.
I really believe with my core that every human being has the right to excellent, outstanding health care. It's not a privilege. And I'm very proud to have one of the Quality Leaders Award and for Care redesign, because we really, have changed almost everything in how we do things in an effort to deliver better care. Because people who work here are heroes every day, doing great things every single day, making big differences in people's lives. And this is just really nice to be recognized. And the department is really proud as well, too.